Hey guys, welcome back to another episode of the SMA Victor Podcast. I am your host, Victor, aka Victor the Inspiration, and I have a fascinating topic to go over with you guys, which is what are the risks of taking Spinraza? So let's get right into it. Hi, ChatGPT. I want you to be my co-host within today's episode, and within today's episode, we are going to be discussing what are the risks of taking Spinraza. Now, I have some information in front of me, and it says the primary risk and potential side effects associated with taking Spinraza, neurosin, are bleeding complications and kidney damage. So, ChatGPT, what does this mean?
Absolutely. So Spinraza, also known as nusinersen, is a treatment for SMA. And while it can be very effective, it does have some risks. Bleeding complications can happen because of the procedure involved in administering it. And there can be some kidney issues, though they're relatively rare. It's always a balance of the benefits versus the risks, of course.
And it says serious risk and warnings, increased risk of bleeding complications. Spinraza may cause a low number of platelets in the blood and coagulation abnormalities, which can increase the risk of unusual or excessive bleeding. Your healthcare provider will perform blood tests before treatment initiation and before each dose to monitor for these risks. You should seek medical attention if any unexpected bleeding or bruising occurs. So ChatGPT, what does this mean for myself in the audience?
In simpler terms, this means that Spinraza can sometimes lower your platelet count, which is important for blood clotting. This means you might be more prone to bleeding or bruising than usual. That's why your healthcare provider will do regular blood tests before you start treatment and before each dose to make sure everything's safe. And if you notice any unexpected bleeding or bruising, definitely reach out to your healthcare provider. It's all about keeping you safe and healthy.
Wow. And kidney damage. So Spinraza may cause renal toxicity, including potentially fatal acute inflammation of the kidney. Healthcare providers will conduct urine tests before starting treatment and before each dose to monitor kidney function. Symptoms may include swelling of the face or ankles, decreased urine output, or blood in the urine. ChatGPT, what does this mean?
So this means that Spinraza can, in rare cases, affect your kidneys. They'll keep an eye on your kidney health by doing urine tests before you start treatment and before each dose. If you notice any signs like swelling in your face or ankles, peeing less than usual, or blood in your urine, it's important to let your healthcare provider know right away. The goal is to catch any issues early and keep everything running smoothly.
Wow. Serious infections associated with the lumbar puncture procedure used to administer Spinraza, such as meningitis, have been reported in post-marketing surveillance. What does this one mean? Can you explain it for myself and the audience?
Absolutely. This means that because Spinraza is delivered through a lumbar puncture, which is basically an injection into your spine, there's a small risk of serious infections like meningitis. And this is why healthcare providers are extra vigilant and take all the necessary precautions to prevent any infection. If anyone experiences symptoms like fever, severe headache, or neck stiffness after the procedure, it's important to get medical attention right away. It's all about safety.
Wow. And I should have known meningitis. I should have known that word. I am extremely tired this week. It's been a very interesting week. We're doing home renovation, so it's just really busy. And anyhow, so hypersensitivity reactions, allergic reactions, including serious ones like swelling of the face, lips, or tongue, rash, or hives, have been reported. So, wow, okay. ChatGPT, can you give more of is there any public data from recent research on Google that showcases what's the percentage of these things actually happening?
According to the available data from Biogen, hypersensitivity reactions like swelling of the face, lips or tongue, and rashes have been recorded with Spinraza, but the exact percentage of how often these occur isn't specified. It's always good to keep an eye out for any symptoms and stay in touch with the healthcare provider if you have any concerns.
Okay. And it says hydrocephalus? A buildup of spinal fluid in the brain has been reported since the drug became available for use. I am so unaware a lot of these risks. This is actually very educational for myself and for you guys as well. ChatGPT, can you please explain this one?
Of course. So hydrocephalus is a condition where there's an accumulation of cerebrospinal fluid in the brain, which can increase pressure and cause symptoms like headaches, nausea, or even changes in vision. It's been noted as a potential risk with Spinraza, although it's relatively rare. The important thing is that your healthcare provider will keep an eye on any symptoms that could suggest increased pressure in the brain. So it's always good to be aware of these risks. And it sounds like you're doing great by staying informed.
Wow. Okay, so I personally, we'll go over these in a minute too. So I personally do take Spinraza, and I know there's numerous risks, involved with the procedure within itself. I didn't know about the kidneys. I have to look it up as well. I know my kidney function is not the greatest. I just thought it was due to my SMA. Now it could be due to my SMA. I have to look into that. But I didn't know it affects your kidneys, and it could potentially cause spinal fluid in the brain, which is pretty interesting. Wow, okay. So increased risk of bleeding complications. So like this one, for example, I experienced increased risk. Okay, well, I somewhat kind of experienced this. For example, I recently had an injection, and we're in November now. It wasn't my injection in August. My injection in April. I think it was April's injection. Yeah, it was April's injection. In April's injection, I had my Spinraza injection, and there was quite a bit of, when I woke up, I personally get sedated for my injections. And when I had my injection, I woke up on the gurney, and there was like a lot of blood on my sheets on the gurney. And the way it was, usually there's always like spots or some blood, but no, this was like quite a bit of blood. And the next day, I woke up with a really big bruise, in addition to being in such severe pain where it became nearly unbearable to like sit, let alone move. Like sit up in my wheelchair became very excruciating. And this went on for like several weeks. And I've been taking Spinraza though since 2017. So I've been taking this for like 8 years. So I've been taking it for a very long time. So I experienced bleeding complications. My kidney function I know is not the greatest. I thought that was just due to my SMA, but now I have to do some more research. Where can SMA affect your kidneys? I'll do a research on that one as well. So my kidney function is not the greatest. For example, like when I do urine test, for my injections, is I used to have to, when I would urinate for these tests, some of the tests would be unreadable or unacceptable just because they say it's diluted, but that's just because I drink a lot of water. And literally my pee comes out like clear, like really, really clear. And anyhow, but there's also like a particular thing they look for in the urine test, and it showcases that, like pretty much it's inaccurate or it's unreadable, where it makes it really hard for them to read the test that they're putting in for because of my kidney function is low. So I can't say 100% my kidney is the way it is because of Spinraza. I thought it was up to my knowledge with SMA. I will make another episode on that right after this one, actually, to learn about it. I never experienced infections I never experienced any infections. I'm gonna knock on wood here on my desk, fortunately, which is, a good thing. I just experienced, again, extreme pain, and this pain lasted for several weeks. And this went on for like 3, maybe 4 injections that I've had, and it was like that. My last one in August was great. It went very smoothly, no pain, which was a huge blessing, because literally being in that extreme pain and trying to work on my computer was extremely, extremely difficult. It was extremely difficult. But me being me, I was just pushing myself and very stubborn to just sit down, in a way. And hydrocephalus, I believe it's called, hydrocephalus, is a blue. Never experienced this. This is interesting. I do get headaches from time to time. I think that is just from life in general, and like personal and professional things going on, and also lack of sleep. Lack of sleep does definitely play a factor, but that comes with the territory of I just have those days, where I have trouble sleeping. It's not because I'm SMA. It's just like you, if you don't have any disability and you're watching this episode, you have your days when it's just hard for you to sleep. You can't explain it. You're not stressed. You're not worried. There's nothing going on, that's keeping you up at night. You're just wide awake, right? And I do have those moments. So I have experienced headaches and some migraines. Usually after the injection, I'll have oftentimes 9 out of 10 times, excuse me, I'll have pretty severe headaches. And with that, I just drink coffee. I just drink caffeine. I'm not much of a coffee drinker or caffeine person personally. Literally my go-to is water. And if I'm at a restaurant, it's water with no ice or iced tea with no sugar. That's literally my go-to. But yeah, so let's move on to the other common side effects. I just wanted to give you guys my own personal story as well with this. I want to be as transparent as possible. So this is literally educational for myself and also for you guys. It's a win-win, Excuse me. And most common side effects. So most common side effects taking Spinraza are lower respiratory infection, such as a cold or flu. Lower respiratory, I was and am aware about that. I actually looked into this with my doctor, with my pulmonologist, and there's so many doctors, and my pulmonologist, and I believe it increases 40%. ChatGPT, can you give an accurate percentage of what's the percentage that Spinraza affects your immune system or your respiratory?
So it looks like about 55% of patients treated with Spinraza experienced lower respiratory infections, and about 40% had upper respiratory tract infections. It's definitely something to keep an eye on, but it's great that you're aware and stay proactive with your healthcare.
Yeah, so I am aware about the respiratory aspect of it, which is pretty significant. That's a really, really big percentage. And I have thought about stopping Spinraza 100%. I really have thought about that this year, several times actually. And my dilemma here is I've seen the impact, the huge amounts of benefits from taking Spinraza when I first began. And over time, I got to see the benefits from it. Now, I'm at a point where I'm I have to think long term, where I'm not experiencing, at least up to my own awareness, I'm not experiencing, the severity of kidney damage, or serious infections like meningitis. I actually do have a friend that did get meningitis from it. And I have thought about is it really worth the risk, like I'm at a point in my life where I'm like, I'm at the age where I'm like, does it make sense anymore? And I'm not trying to be pessimistic. I'm just trying to think realistic, the with where we currently are within the SMA treatments in terms of medications. I'm still in that dilemma. I am still taking Spinraza, but I am still in the middle. Again, I've been taking this for 8 years, so there's just a lot of factors I have to think about. Like the respiratory, that's a big one. Lower respiratory, as it is, SMA comes with the territory of having a weak immune system by default. So, adding on to lower respiratory is, you're adding on to increasing the risk, of you catching a cold or flu. And usually, like for me, I don't often catch a cold or a flu. It literally just jumps from like a cough to you, or whatever is a cold or a flu to you, is an immediate pneumonia and collapsed lungs for me, where I am in the hospital 9 out of 10 times, or 8 out of 10 times, I should say, and which is significant, right? So, and also it comes with the territory. Okay, so I'm taking Spinraza to help me be stabilized with my physical strength, but when I get sick, or I fall under the weather, what happens? You feel fatigue because you're under the weather. So there's like so many things I have to balance out, take into consideration. And again, I'm just like at that age now where I'm like, does it really make sense anymore to continue on this journey? As it is, the injection site is so complex where they have to administer my own Spinraza injection, which is literally their only option. I thought they had another option, but they don't. There's literally only one accessible option to access the spot they need to administer Spinraza. And the complication, the complexity behind it is because of my severe scoliosis. It makes it extremely, extremely difficult. And, so where I'm going at that is because they have to access the same spot over and over and over again repetitiously for 8 years, is building up scar tissue. So it's making it a little bit difficult for the needle to penetrate through. So there's like a variety of different things going on, and I have to take into consideration. If you really want to learn more about my personal life story with SMA, especially with these past several years, look up at Victortheinspiration on YouTube, which is my other YouTube channel. And even if you scroll down on the homepage of YouTube, my YouTube channel will be right there as well. And I literally have dozens and dozens of videos literally just talking about my life with SMA. So other complications and side effects, let's move on, is fever, constipation, headache, vomiting, back pain, post-lumbar puncture syndrome, side effects resulting from the injection procedure, such as headache or back pain. And the next one is, let's scroll down here. And I changed, if you've been keeping up with my episodes, I changed my camera angle where it was actually down here on the bottom, and I moved it up here. Let me know what you guys think. And I added, right here, the SMA Victor Podcast, I think is kind of cool. I'm experimenting. I'm just trying out different stuff. Important precautions. Let's move on. Lab monitoring. Regular blood and urine tests are essential before each dose to monitor for potential bleeding and kidney problems. And then follow-up one is pregnancy and breastfeeding. There are no adequate data on the use of Spinraza in pregnant women. Tell your healthcare provider if you are pregnant, plan to become pregnant, or are breastfeeding. And thirdly, we have administration issues. The presence of scoliosis can make the lumbar puncture procedure more challenging, sometimes requiring imaging guidance. So for me, I do need imaging guidance. So I go in every time and I go through that process. So ChatGPT, can you explain those 3 things that we just discussed about important precautions?
Absolutely. So the first precaution is about lab monitoring. Basically, before each dose of Spinraza. We do blood and urine tests to keep an eye on your kidney function and your blood's ability to clot, making sure everything stays safe. The second precaution is about pregnancy and breastfeeding. There isn't enough research on Spinraza's safety during pregnancy or breastfeeding, so it's important to let your healthcare provider know if you're pregnant, planning to become pregnant, or breastfeeding. And the third precaution is about the administration process. Because of severe scoliosis, the lumbar puncture can be more challenging, so they sometimes use imaging guidance to make sure they get it right. It can make the whole process a bit more complex, but it's all for your safety and comfort.
Yeah, definitely. And the team, the medical team, staff, medical professionals that are all behind me getting these injections, are wonderful. They're great. They're phenomenal, to say the least. And but yeah, I just wanted to share my own personal journey with Spinraza, and also I've been wanting to make a video talking about what are the risks of taking Spinraza. I have another video somewhat similar to this, but an animated style, like posted maybe a year ago, 2 years ago, roughly around that time. It's been a while, and I wanted to make more of a in-depth video like in this kind of style and going over it together. It's very informative, educational. I learned a lot within this episode about my own disability, and I hope you guys too learned a lot from this episode. I am making this episode, my intention is not to scare you about the side effects and talk about the negatives, the downsides of taking Spinraza. That's by far not my intention. My intention is to educate and inform you guys as much as possible. Like, I didn't know there was some things I didn't know about the risk of taking Spinraza. But there are a lot of individuals who are taking Spinraza, and it has worked tremendously great. To give you a little quick synopsis about my own personal story is I was in high school at the time. I was in school at the time. My SMA had progressed to the point where it became very difficult and challenging for me to keep up with writing notes and writing in class, where I needed an assistant, a teacher's aide, to come with me in particularly in English. In English, occasionally was math, but it was primarily English, and was it history? I think history as well. And there was like 2 classes I primarily needed help with, and that went on for a short while. But it went on for a short while by choice. I wanted to emphasize on that as well. You guys didn't think like something happened. But yeah, I was struggling in school with writing, and to put in, give you guys a imaginative visualization is to write a sentence, let alone a paragraph, became very difficult. The more I began to write, my handwriting got extremely sloppy to the point where it became very difficult, where I myself, it would be hard for me to read what it was I wrote. It became very difficult. And essentially, the more, I cannot speak for every SMA individual, but for myself, is the more efforts I put towards something or anything that regards physical activity or movement or involvement, the faster my energy goes and is drained, where it limits the opportunity to begin and do something else. So to put it simply is, the more I would write on paper, it would make me more tired, where it would become harder for me to now carry on and begin my next class. Because again, my physical mobility my energy level is much lower. So I want to emphasize on that as well. But, this was before taking Spinraza. Then after I started taking Spinraza, then what happened? I actually began writing full pages. I began writing pages to essays and notes, and I was able to do a lot more. Before I started taking Spinraza, I was struggling with like my daily routines, brushing my teeth, feeding myself, homework, because I was in school at the time, things like that, and picking up my drinks, picking like a water or whatever it was I was drinking. And, after taking Spinraza, it was like the contrary, where I was able to brush my teeth. I was able to hold my phone, pick up my phone, utilize my phone. I was able to write. I got to the point where I could write full essays. And again, this was in high school, so we're talking about like 7 years ago, 8 years ago. And now I'm at a point where I am starting to see a decline. I want to say more of like a stabilized. I'm stabilized, but I've been feeling a slight decline. Now that there's a lot of multiple things I have to take into equation. When was I ill recently? Was I feeling under the weather? Yes, I was feeling under the weather. Like 3 weeks ago? Like I actually recorded content, and I am like literally coughing. I don't think it was on this YouTube channel. It was on one of my other YouTube channels. But I'm like literally coughing, and my eyes got watery because I'm just coughing so much. You can hear the phlegm in the microphone. That's how bad it was. But I just really, really tried to stay consistent with what I can do, as much as I can do, with where I'm at. And so where I'm going with this is I'm starting to see a slight decline. But again, I have to factor in, okay, was I feeling under the weather? And my respiratory health has been off and on quite a bit this year. But the fortunate thing is I haven't needed medical intervention, meaning I haven't needed to go into the hospital, which is always a blessing within itself. Literally last year for Thanksgiving, I was in the hospital for like 3 weeks. And that was quite the journey, quite the process. It was a very, very hard time. And, but yes, I just, here, I like my intention here again is not to make you guys scared or terrified about taking Spinraza. Like I'm just sharing my own personal story. Everyone's story is different and unique, accustomed to their own. But I hope you guys can take away with you the value that resonated with you most. And I hope that my story can highlight the possibilities of the goodness Spinraza can do for you as well. It's been quite the journey. It still is. And the best thing we can always do is just do the best with where we are with what we can, Just do the best you can. That's like the greatest advice I can give to anyone with SMA or any disability, or anyone. You don't even have to have a disability, but just do the best with what you can, with where you are, and try as much as you can to seize the moments of opportunity to do these things, before it's too late, in terms of, your mobility starts to weaken, where, things you could have done, you waited too long, it's a little bit more challenging because you don't have the physical strength to do so. So again, just do the best with what you can, with where you are, and everything else will fall into place. Just trust the process. ChatGPT, can you close out today's episode with a great, positive, uplifting message, offering some words of wisdom and encouragement for myself and the audience?
Absolutely. First of all, thank you so much for sharing your journey and being so open and transparent with all of us. It's truly inspiring. Remember that every step you take, every bit of effort you put in matters so much. And even on the tough days, your resilience and positivity shine through. Just know that you're making a difference, not just in your own life, but in the lives of everyone who listens to your story. Keep going, keep believing in yourself. And I know that you're absolutely capable of amazing things. You got this.
I love it. I think this was a great episode. I've been, excuse me. I think this was a great episode. I've been saying this a lot, actually, with my past recent episodes. And it's not just because I'm creating them. Literally, I just really, really mean I'm having fun. And I'm enjoying the process of creating this kind of content along with all of my other YouTube channels. And it's just been quite a journey, like I learned a lot just within this topic alone. And speaking about it too helps me retain the information much more than just reading it. It's a different type of it's just different. When you speak about it, you begin to remember it a little bit differently. compared to just reading it. Yeah, I hope you guys enjoyed today's episode. Please like the video if you enjoyed. Please subscribe if you guys are new to the channel. We are so close to reaching, I am so close to reaching, because we're building a community here. We are so close to reaching 100 subscribers. We currently have 84 subscribers at the time of this recording, which is November 7th. You guys will not see this until November 10th, I believe it is. And I hope you guys enjoyed today's video. Again, like the video. Comment down below what you guys personally enjoyed within today's video. And if you have any questions in regards to SMA, personal life, anything you guys personally want to see within another episode, please drop them down within the comments. I would love to hear your thoughts, your opinions, perspectives. I would even love to hear your story. I love you guys. I appreciate you guys. And as always, remember, grow through what you go through. Much love.